Okay friends, so welcome back in another video tutorial for microbiology with Shaknik. So in this video tutorial we will going to discuss about the treatment of Mycobacterium tuberculosis. So I will going to take two videos for the treatment of Mycobacterium tuberculosis. For one, I will going to talk about all the drugs that you can use for Mycobacterium tuberculosis treatment, and in the second video we will talk about directly observed therapy or dot therapy. This dot therapy is recommended by WHO especially for Mycobacterium tuberculosis. I will take a separate video on that. So first let's talk about the first video. So the main way to treat Mycobacterium tuberculosis infection, no matter whether it is latent infection or active infection, is the antibiotic. Okay, if it is latent infection, I hope you know about what is latent Mycobacterium tuberculosis infection and what is active. Latent means under such circumstances immune system is totally controlling the entire situation, and the Mycobacterium tuberculosis is inside our body but they are dormant, right? So under such circumstances you can use only one drug for long time, especially we are using Isoniazid for 9 months. So what is the term Isoniazid is? So Isoniazid is a cell wall synthesis inhibitor, but it is especially for Mycobacterium tuberculosis. You cannot use Isoniazid again Bacillus anthrax or any kind of bacteria, okay, for as a cell wall synthesis inhibitor. Okay, why? Because Isoniazid only have the ability to inhibit the mycolic acid synthesis, and we all know that mycolic acid is the component for the cell wall of Mycobacterium tuberculosis. Okay, so we are only using Isoniazid for Mycobacterium treatment. Okay, that is the thing to remember. Okay, so we can use Isoniazid for 9 months in case of latent infection. And what is active infection? Active infection means, friends, that here your immune system somehow get compromised. That may be due to aging or that may be due to AIDS, and under such circumstances now your gone focus is activated and it causing formation of cavity in the lungs and causing another kind of symptoms, right? So under such circumstances you have to use a mixture of 4 different drugs. Okay, one is Isoniazid. So I have told you about the mode of action of Isoniazid. Another important information that Isoniazid is a prodrug. Okay, Rifampin, I think I don't need to talk about Rifampin, that it have the ability to inhibit the bacterial DNA dependent RNA polymerase. Okay, and the third one is a ethambutol. What is ethambutol? Ethambutol is bacteriostatic against actively growing TB bacilli. Okay, and the last one is pyrazinamide, which is a prodrug that stops the growth of the TB. Okay, so whenever we are talking about active infection, we should use a mixture of these 4 antibiotics. Okay, so now after that we have to talk about the drug regimen. That means how those mixture of drugs should use. So usually the treatment duration is 6 months. Okay, and we will use Isoniazid and Rifampin for the 6 months, and 2 additional drugs, that is ethambutol and pyrazinamide for first 2 months, okay, of the 6-month treatment period. And sometimes the standard regimen is 9 months also. Okay, so what is the if they tell you to write the drug regimen for Mycobacterium tuberculosis, then you should write that usually a 6-month treatment course is followed, and in that time we have to use Isoniazid and Rifampin for the 6 months, and then the ethambutol and pyrazinamide for the first 2 months of the 6 month of the treatment period. Sometimes we are also using a 9-month drug regimen. Okay, so now let's talk about an interesting thing, that is drug resistant Mycobacterium tuberculosis. So the first kind of drug resistant type is multi drug resistant Mycobacterium tuberculosis, known as MDR-TB. Okay, so this MDR-TB develop resistance to Isoniazid, rifampicin with or without other first line drug. You know what? That the mixture of the antibiotics that we are using are commonly known as first line drugs. Okay, so MDR-TB will surely develop resistance against your rifampicin and isoniazid, that is no doubt, and it can also develop resistance to either or both ethambutol and pyrazinamide also. Okay, that means it will develop resistance against isoniazid and rifampicin, no doubt about this. Along with that, it can also develop resistance against ethambutol and or pyrazinamide. Okay, so that is the type called MDR-TB. So for treating them, we have launched the second line drug. For example, amikacin, capreomycin, ufloxacin, ciprofloxacin, capreomycin, ethionamide, cycloserine kinds of drugs. They are known as second line drugs that have the ability to treat MDR-TB. Now, under such circumstances, very unfortunately, Mycobacterium tuberculosis also develops resistance against those MDR-TBs. Okay, and such kind of strain are known as XDR-TB mycobacterial strain. So they are having resistance to isoniazid and rifampicin. Not only that, they have also resistance to any fluoroquinolone and any of the 3 second line injectables, for example amikacin, capreomycin, kanamycin. Okay, so this kind of antibiotics are known as second line injectables. Okay, so for the drug resistance, we have learned about there are 2 kind of Mycobacterium tuberculosis. One is MDR-TB, that is multi drug resistance TB. They have developed resistance to isoniazid, rifampicin with or without other first line drugs, and the XDR-TB have developed resistance to isoniazid, rifampicin and to any of the fluoroquinolones and any of the 3 second line injectables, for example amikacin, capreomycin, kanamycin. Okay, so that is the first video for Mycobacterium tuberculosis treatment. In the next video, we will going to talk about directly observed therapy, and that will going to be the last video from the Mycobacterium tuberculosis. Okay, so thank you for listening to this class.